Okay, welcome. Can everyone hear me okay? Yeah, I don't think we need the mic. We're going to talk this morning about integrative therapies for ADHD and behavioral disorders for children. We're going to have a discussion. I'm going to bring up lots of topics. I'm not going to be able to cover all aspects of the kinds of integrative therapies that we might consider for treating children, but to try to give you the big picture, kind of share some of the controversy, and also try to guide you in some direction as to how to get some support. We're going to take a break somewhere, so there'll be plenty of time for questions at the break with some of the staff from the office, as well as we'll leave time at the end for questions. Okay, this is a little memory lane. 1993. Really, sometimes very frightening when I'm talking to patients and parents who weren't born in 1993. But some of us, I moved back to Boston in 1993 in Norwood, Mass, and I was working at Norwood Hospital, and they said, child psychiatrist, they said, we need someone to talk about ADHD. I gave a seminar in 1993, and I was interested in alternatives to medication. And I remember we had a couple hundred people at the Holiday Inn to get them. And for 2 years, we pretty much set up an ADHD clinic in Norwood. And this was a little bit of what my life was like for those 2 years. Parent number one coming in screaming, I need medicine for my child today. And then the next, and they would leave, and either angry or not angry, depending on what I did. And then a parent student, my child will never take medicine, it's going to cause them to be a criminal. And it was both overwhelming and gratifying in many ways for those parents and kids that could look at some of the testing and take nutrients. At the time, the testing that we were using cost $2,000 to $3,000. Expensive. And the supplements were not as kid-friendly, so there were big pills, so it was hard to get those into our children, so it was a little frustrating. What I'm going to share with you today is very similar to what I shared with a group in 1993. Okay? What we know about some of the underlying biochemical contributing factors to behavioral disorders in children have not changed dramatically. Now, the nice news for me, particularly speaking to colleagues, is I can use words like double-blind placebo-controlled trial and research, British Journal of Psychiatry to support some of the things we were talking about. But many of these things have been around for a long time, and I help the clinicians in the room and help spread the word and share that with our patients and for those families we can begin to look at how to treat it. So I have a lot of slides, I can get a little carried away, so I'm going to go through some quickly and just focus on the high point. We're talking about the most common referral, and it's not only to psychiatrists, but the therapists, the pediatricians, the child neurologists, is my child is not paying attention. You have much to learn, my son. You can't say on with his head after you said off with his head. The consequences of ADHD can be profound and sometimes difficult to understand. So here's where I always start. This is not a disorder created by TV and junk food. This is a disorder that we've described before 1900. There's a poem about fidgety Phil, right, written I think in the 1700s. So we've had children that have been described as impulsive, overactive, not being able to pay attention outside the norm for hundreds of years. We cannot blame everything on junk food and TV. We can blame a lot, but not everything. But here's the world that the professionals have journeyed through over these 100 years as to what to do with some of these children. So in the early 1900s, defective moral control, right? It was a moral issue. And then they focused on, these are the official psychiatric diagnoses, these are the names that we use. So restless syndrome, focused on the hyperactivity. And then we went to brain injured in the 40s. And then I think we felt bad for the kids. Well, they're not really brain injured. We just said, oh, minimal brain damage. And damage wasn't good, so we went to dysfunction. So these are the actual names we used. And then we got into hyperactive. And then for years, we missed all these inattentive kids, particularly females, right? The female ADD world was just, didn't exist throughout the 60s. And all of a sudden, the 80s, we went to ADHD with and without hyperactivity, and all of a sudden now we have it all combined, ADHD. So the name has changed, and to me it just reflects how poorly our profession understands these kids. All right? Make sense? Okay, so someone asked, why am I doing this talk again after being in retirement for, what is it, 20 years? Well, part of it is when I read this. Our American Academy of Pediatricians, and I hope I don't offend any pediatricians in the room, but they decided that medication is appropriate for children as young as 4 years of age. I believe that not looking at what we're going to talk about today to children under 10 is malpractice in my book. Okay? If we can find a cause, whether it's lead, toxicity, or a food allergy we'll talk about, then we should not really be medicating 4-year-old children. If we can't find anything and these behaviors are dangerous, then we can discuss it. So in our world of psychiatry, it is very different than the rest of medicine. In the rest of medicine, we have all these wonderful tests, right? We can do blood, urine, hair, stool, we can put you in an x-ray, we can get a scan of anything. And we can say, you have pneumonia in your left lower lobe, and we're going to give you an antibiotic, or that's cancer, and we're going to do X. So what do we do in psychiatry? You walk into that therapist's office, or that psychiatrist's office? Not much. We ask a lot of questions. And so we have this wonderful tool called checklists. Okay? These are the scientists of my colleagues, right? They think they're doing a checklist, and that's science. We're going to ask you a bunch of questions. So let's look at the checklist that we ask our parents for ADHD. Okay. Anybody have kids? Well, I have a couple. Often does not seem to listen when spoken to directly. And so that's formal criteria to say that your child has ADHD if they meet six or more of these things. How about this one? Often loses things. Diagnostic criteria for mental illness. So our checklists are very, very poor guides. Or how about the hyperactivity piece? Fidgets, talks excessively. Well, I'm kind of glad when my daughter comes home very excited about something and tells me a wonderful story, right? I talk a little fast, but it doesn't mean they have ADHD. So our criteria, our only criteria to diagnose ADHD are a bunch of checklists. Now, if the first slide about the changing the name every 5 years doesn't scare you, hopefully this does. Okay? We do not have a lot of objective criteria, which means parents, teachers, professionals are all making somewhat subjective. There's a list of symptoms. The only thing our profession, and if you Google now anything to do with ADHD, the entire web is owned by the pharmaceutical industry. Okay? Every informational site, if you read on the little bottom, is sponsored by a drug company, so you eventually get to the links of their drugs. But anyways, that's all we have. This is our little polypharmacy highway for depression. We can make up the same slide for ADHD, but we have one drug and then another. And part of the other reason that I'm really wanting to talk about this today and get the word out is because we are seeing kids 4, 5, and 6, not on one medicine, but 2 and 3 and 4, because they're not getting better. And we're going to talk about why they're not getting better. And that's my little, without a navigation system, getting lost on this highway. Samantha was a recent child that I saw, and to me what's more important than the name is the consequences. And I call the developmental consequences. I mean, kids that biologically have struggles in these areas of attention, impulse control, and overactivity, and what that is like to them, their growth and development, and to their sense of self. So after how many years of being told you are lazy, you are stupid, you are dumb, your other siblings are so much smarter, it takes its toll. And this is a girl that I saw recently who parents were very adamant against medicine. They thought it was just a discipline problem because their other two kids did not have problems in school. And this poor girl, for the first time, being evaluated, was not only tearful in my office, but thoughts of suicide in my office based on her inability to control this, and had never been able to really articulate that to the parents, what it was like to be called dumb and stupid and lazy for 10 years. ADHD is a performance disorder. It's not a skill disorder. It has nothing to do with intelligence. It has to do with how you execute those behaviors. We clearly know there's a genetic association. 30 to 50% of kids that we're seeing with ADHD have a parent with a attention or impulse control disorder. How many people have heard the term epigenetics? So that's my new favorite word in terms of our genes are a liability. It's not our destiny. So epigenetics means those things that can control the expression of our genes. So we might have this genetic liability to be a little impulsive or overactive. Those could all be reframed as very positive symptoms, but depending on some of the things in our environment that we'll talk about today, whether it's toxins, whether it's nutritional deficiencies, then it could affect the expression of those genes. And that's the term epigenetics, and it's a real, very powerful tool for throughout medicine, and cancer research, as well as mental health research. I hope that's about all of them. I'm beginning to lose interest. Right, so what is the one question that is your diagnosis of ADHD? I'm bored. Right? And it doesn't always mean they're not challenged. It's a neurochemical function that we're going to talk about. So this is the framework. Again, we're not going to be able to talk about everything today, but this is kind of how I want you to at least begin to see how we would look at any psychiatric problem. But if we talk about ADHD, this is an old slide from Sidney Baker, a pediatrician who did a lot of work with autism. But basically we're saying, or I'm trying to share with you, someone walks into your office or your child in front of you has a problem. The name is meaningless. That checklist, whether they meet criteria for ADHD or not, really does not help me, and it does not help the child. But there's something not right. They're not functioning up to their potential. They're not working up to their potential academically, their social life, or their home life because of these kind of behavioral manifestations. So something is wrong, and we just ask two questions. Is there something the patient needs? Is there something we need to avoid? And that's really the theme that I will share with you today. Is there a vitamin deficiency? Right? We're going to talk about essential fatty acids and magnesium. Is there too much hormones, thyroid hormone? Or even things like light. We'll talk about there's an association between light and ADHD, or just affection, love, support, respect, all the other kind of psychosocial things. Is there something that individual needs? We can assess and test for all these things. And then maybe is there something that patient needs to avoid? Right? I'm not going to even talk about lead, but there's not a more direct correlation between high lead levels and intelligence and behavioral problems in children around the world. It is dramatic, it is clear, and we stopped focusing on looking at lead in our children. Okay, is there something they need to avoid? So there are pesticides, we'll talk about it. There are heavy metals, and there are allergens, there are foods, there are environmental allergens, and then there's our own immune system getting in the way. So, simple model. Is there something that patient needs? Is there a deficiency, or is there something toxic? Now, a 10-year-old child that you're seeing, or one of your children, could have both. Could have high levels of copper and low levels of zinc. Oh, here's our heavy metals. Okay, so when we start off as what do we need to avoid, it's hard, I think I need to go to my graphs first. It's hard not to appreciate that I think we have over 10,000 chemicals being added into our environment, and we only have tested a couple hundred. So we know, and there are studies looking at the number of pesticides, organophosphate exposure, contributing to ADHD. Okay? Studies have been done a number of years, and newer ones in the last year. Higher number of these organophosphates, higher incidence of ADHD. Is there something we need to avoid? Again, most of these have never been tested. You know, our medical colleagues have started catching up with the rest of us in the nutrition world, and all of a sudden it's okay to think about fish oil, and it might be okay to recommend broccoli to your children now. But the one thing that is still very hard for our medical colleagues, particularly our pediatricians, to accept is that certain foods might be aggravating, might cause behavior problems in children. And I'm going to start with the simplest, celiac disease, which is an immune reaction to gluten. And what I see a lot of, is certainly I see a number of college kids and young adults, is the relationship between celiac disease and ADHD. And it's just a nice overview of everything I'm talking about today, because what is celiac disease? It's an autoimmune intolerance to gluten, so it destroys your intestinal villi, right? So you can't absorb nutrients. So what happens if you can't absorb nutrients? You become malnourished, and your brain doesn't work as well as we would like. So when we talk about depression, we know people with celiac disease have 2 to 3 times the incidence of depression. But what I'm seeing is our diagnosis of ADHD. So we have one kid who I saw last year, did well in high school, all A's, went to a good college, and started doing poorly at school. Can't pay attention. Went to the college psychiatrist, started getting amphetamine. You know, one amphetamine in the morning, another one in the afternoon, and because he was so hyped up, he had to take Xanax in the evening. Over the course of the year, the amphetamine doses kept getting higher, and the Xanax doses kept getting higher. He was quite a neuropsychiatric mess when his parents came to see me. And, you know, healthy young male, otherwise, and we did just routine nutritional deficiencies, and he was deficient in everything. He was iron deficient, B12 deficient, and he was a meat-eating male who was relatively healthy. It turned out he had celiac disease. Okay? So, I don't know when he developed it, but over a couple years of not absorbing many nutrients, he couldn't pay attention. So rather than just giving him amphetamine, if someone did a screening test, we would avoid it. It was actually a serious drug problem when I saw him 2 years after amphetamines and Xanax. So, things that one might need to avoid would be celiac. How many people have heard of the Feingold? Wow, so that's the difference. In 1993, it was kind of the buzzword, right? In 1970, this allergist, who was a physician, Ben Feingold, said, and guess what? There's maybe something in that Hawaiian punch that's causing your kids to run around the room and not stop. And in his studies, he didn't say every child, it was 40 to 50% had a sensitivity to these artificial dyes and colorings. And that was the Feingold hypothesis. And he said this in the 70s, and it got a lot of press because the parents said, okay, let's try it. And there were a couple studies, and many of them, academic medicine kind of discounted them. But guess what's happened in the last couple of years? This was the first study, Archives of Children, which is a very academic pediatric journal, that started looking more scientifically and said that, hey, there's a group of children that actually did respond, increased in hyperactivity to these artificial dyes and colors. This was 204. Then it gets better, 207. In Lancet, very reputable medical journal, they were able to look at almost 300 kids, 3 to 9-year-olds, and they found an increase in hyperactivity in a subset of these kids. And then it gets better in my world. In 210, they were able to actually look at a genetic profile, that some kids were genetically prone to have reactions to artificial dyes and additives. So our medical community, one of the slides that I used to use all the time was, when I talk to parents, is your child is not a statistic. Okay? When we do a research study, we put 100 people in a room. We give them all Hawaiian punch, 110-year-olds. And then we rate them, our little rating scales. And if, let's say, only 10 kids had severe reactions to that Hawaiian punch, 90 kids didn't. So what is the research? What's the headline going to say?
No,
Red dye number 6 is fine for children. Okay? There's no proof that red dyes affect our children. Well, your child's not a statistic. What if your child's one of those 10 kids? And I don't know about you, but I've all seen them giving some of these, Gatorades or red dyes to a child who cannot stop for hours. And this was a recent study that actually was able to show, which we are showing more and more in psychiatry, that genetic vulnerability to some of these reactions. So the research that your pediatrician is going to show you, and when we talk about sugar and everything else, to say that, oh, don't worry about the red dye. Well, statistically, that might be the academic conclusion. But it is clear, and now we have research supported, that there are some kids that are going to be sensitive. So understanding the fine gold diet, understanding the foods that you're feeding your children is certainly a simple, easy, healthy way to begin if you have a young child with behavioral problems. Another really common concern in the kids that we're seeing, particularly the younger children, and something very hard for sometimes our pediatric colleagues to embrace. And there are lots of different food allergies. We're all familiar with the nut table, or it's the nut-free table, right? So the nut-free table, because there's a dramatic increase in these immediate hypersensitivity reactions, right? And that is called an IgE, immediate reaction. That is different than the kinds of food allergies that we believe are associated with behavioral problems. Okay, those are called IgG delayed hypersensitivity reactions. And these are some of the symptoms. So we're not getting hives, our lips aren't swelling, and we don't get shortness of breath. But the most classic is those black circles under the eyes. Have you seen that? Okay, these kind of pale kids with these very black circles under their eyes. Common colic as a child, eczema, reflux, complaining of bone pain, GI discomfort, insomnia, odor, bad breath, itchy ears. Okay, all common symptoms of food allergies. It's a simple test. You can do a blood test, and it is a very helpful guide as to which foods these children might be allergic to. The other thing I share with parents is that my job has gotten much easier over the years since 1993 as the testing has gotten better. But again, it's easy for me to say your child might be allergic to eggs. If you have 2 other kids at home eating eggs for breakfast every day, it might be more challenging making some of these interventions at home. But the tests are pretty good. And again, for a 18-year-old, 22-year-old with ADHD, the food allergies I think are important, but not as significant for these young children under 10. Sometimes eliminating these foods can make a huge difference in their behavior. Another part of what is our, if we need to eliminate certain things, there are different reactions to dairy and wheat in particular that I want to talk about. How many people have heard of casomorphin or gliadorphin?
From you.
From me, okay. Well, it's not everybody, but there are individuals that do not digest dairy or wheat completely. So they don't have adequate digestive process for lots of reasons, and they break down the milk protein to a peptide called casomorphin and gliadorphin. What does casomorphin sound like? Morphine. It is a morphine analog that crosses the blood-brain barrier and has an effect like morphine. And anybody who's been on morphine or interviewed 10 people that have been on morphine, there's some people that are going to get irritable, some people are going to get headaches, some people are going to get calm, some people are going to fall asleep in a minute. We all have these individual reactions, and it's the same with these, we call them neuroactive peptides. So here's the theory. You're eating macaroni and cheese for breakfast, grilled cheese for lunch, more macaroni and cheese for dinner, and maybe pizza in between. But your high doses of casein in your diet, if you have adequate digestive enzymes, you break it down to this casomorphin, and then you have this other enzyme called DPP4, and here, and we break down the protein into its amino acids. If we don't have adequate DPP4, we get this casomorphin that goes into the brain. And again, for many autistic kids, it is very significant. Early onset distorted behavior, we see this a lot. For the ADHD, it's not everybody, probably say 10, 20%. But if it's part of the problem, then we utilize the dietary changes and the enzymes as part of the solution. Elevations of these neuropeptides we see obviously in celiac disease, ADHD, autism, and most of the work that we've seen is OCD and actually eating disorders. Without adequate digestive enzymes, you need nutrients to build these enzymes, you're going to get these elevations in these neuropeptides. And it's a simple urine test. It does not take long for these to normalize. It's about 2 or 3 months if we're eliminating the food and taking the enzyme. So, if you have a severe child with behavior disorders, I do not tell parents that everyone should be off wheat and everyone should be off dairy. But I would encourage the testing for dairy and wheat. And there could be lots of different, and let me just summarize. So someone could have celiac disease, and we can see this in 3-year-olds, and we can now see the onset in 23-year-olds. Someone could be lactose intolerant, just have GI upset because they don't have enough lactose. That's different than the kinds of things we're talking about here. An IgG food allergy, an immediate food allergy, not having enough of this enzyme, and then we're now seeing, and there's actually good research on the what's called gluten sensitivity. So it's not celiac disease, but we're seeing clear immunological and physiological changes without having the celiac process. All these things can be tested for and then treated accordingly. But just share with you that there is a compound, see if I can, let's start here. So, how many pounds of bacteria are we all carrying around in our gut? 4, 5? Think about that. My 12-year-old was a little grossed out, but 4 or 5 pounds of bacteria line our GI tract. We would not be able to function well without them. They do lots of things. They protect our gut, they make vitamins, and they have a very happy life of their own. And there are about 100 different strains of one bacteria called Clostridium. There's a very dangerous strain, that Clostridia difficile, that can cause life-threatening illness, and a lot of benign strains, but there's one couple strains that produce a chemical called HPA. And all I want to share with you is this metabolite of Clostridia affects your metabolism of neurotransmitters in the brain, dopamine and norepinephrine in particular. Okay, and we're going to talk in a few minutes about how we treat ADHD, which is optimizing the dopamine and norepinephrine in the brain. So if we have this, again, a simple urine test, it is usually those ADHD kids that are aggressive, irritable, and when they come to see us, those are the ones that do not respond well to medications. Why? Because we have something fueling the system, and until we get rid of this metabolite, you're not going to be able to treat the ADHD. And again, it's a simple urine test, and we can look for levels of HPA. Okay, yeast, and then we're going to finish up all the things that are getting in the way. In the old days, when I started, yeast was the cause of every illness known to mankind, right? In the 70s and 80s, overgrowth of yeast was something that people were treating for every illness. And again, you did a study, 100 people, put them all on antifungals, not everyone's going to get better. But overgrowth of yeast, let's see, here's our symptoms, can be a very common aggravating factors in our kids with ADHD. And we can test for it. Okay? These are some of the symptoms: the excessive cravings for sugar, some of the mood swings, inappropriate behaviors. And again, these are also the kids that don't necessarily do well on medication. We test for it, we can do a stool test, but we all have some yeast in the stool. Then we can do a urine test, again, looking for metabolites of yeast that should not be in the body. Overgrowth of yeast can be treated with medications and dietary changes, and we can make a significant dent in it. Here's some of the urine tests of how we treat it. Okay, so I want to start with all those things we needed to avoid, right? Food allergies, yeast, heavy metals. Now I want to talk about kind of other things that we might be deficient in. And we talk about neurotransmitters. Everyone thinks about what? Serotonin, dopamine, norepinephrine. But there are hundreds of chemicals in the brain that help us think, help us behave, and regulate our moods. So there's not just 3 neurotransmitters. There are hundreds, and it affects every aspect of our physiology, including our behavior. And when we think about our current treatment for ADHD, we think about stimulants, right? All the different kinds and names, and these are just some. There's probably 10 others, because as soon as one comes off patent, we come up with a different version and make it long-acting or short-acting or liquid or pills. But we have at least 10 different stimulant medicines to choose from. And what do these medicines do? Why are they helpful for ADHD? They have one major function in the brain. This is just describing methylphenidate, which is Ritalin. It acts as a dopamine and norepinephrine reuptake inhibitor. It keeps dopamine around longer. Okay? So that's all we need to know for the next 15 minutes. All of these stimulants, all of these amphetamines do the same thing. Okay? They help optimize the function of dopamine in the brain. You've heard that, right? Makes sense. And these medicines, they can work very well. But so can cocaine, right? Cocaine causes a tremendous rush of dopamine very quickly, and you feel very good very quickly, then you feel very bad very quickly. But we know if we can enhance dopamine, we are going to function and pay attention better. The more complicated piece that we're not going to be able to go into today is all the different ways that one could have some dysregulation in dopamine metabolism. And each one would be an hour lecture, but there's certainly genetic vulnerabilities that we talked about. It's not usually too hard to get to a relative with a similar pattern. We're going to talk a little bit about diet. We're not going to talk much about stress, neurotoxins. They mentioned this concept of immune dysregulation. Inflammation, other parts of the body can affect neurotransmitter synthesis in the brain. So, let's see if the pointer, oh, there it goes. So what we're going to chat a little bit about today is if here's our dopamine, DA, right? Everyone get that? To make dopamine, we need the amino acids, actually L-phenylalanine and tyrosine, and it goes into the brain to make dopamine. And then all these vitamins and minerals are critical to help us make dopamine in the brain. We talked a little bit about why dopamine is really important. Because not only does it help us pay attention and function, enhancing mood, and also this sense of reward, okay, pleasure. So let's make our list. Food, sex, having someone paying attention, all release dopamine. For those that like skydiving, would produce a rush of dopamine. For those that enjoy a musical instrument or another hobby, would produce dopamine. So our body is kind of set to do that. Animals that lack dopamine starve to death because they have no motivation to eat. Okay, so if we do these little experiments and breed these rats, I think they were rats. No, I think there were also monkeys too, but they're different animals that if we have no dopamine receptors, then we just don't have any motivation to stay alive. So pretty dramatic, but that is the neurotransmitter that the brain needs to seek pleasure, reward, pay attention. And again, similar to the schematic here, we have these amino acids. And where do you get amino acids from? Protein. And where are you getting your protein from?
Animal products, beans, whole grains.
Okay, from your diet. Animal product. And then your body goes through this incredibly wonderful series of biochemical reactions, and we need all these vitamin and mineral cofactors to get to our dopamine. And in the brain, here's our one cell where we're making the dopamine. It crosses the little synapse here to get to the other side, and that's where it hits the other neuron where we want to pay attention. And what we are going to talk about when we look at nutritional alternative treatments for attention, we want to try to, focus on getting adequate amounts of the amino acid, and then getting adequate amounts of these cofactors, the folate, the B6, zinc, and magnesium. You need the entire package to optimally synthesize the dopamine. So let's just take B6. This is an old study. It's the only one I have. But 1979. 6 kids that had low blood levels of serotonin. Not a test we routinely do, although I just found a lab that does this, so we're going to start doing it in the office. So looking at whole blood serotonin, those kids that had low levels of serotonin, B6 worked better than the stimulant, the amphetamines, for the treatment of ADHD. Now again, not every child has low blood serotonin, not every child is going to benefit from B6. So if we did a study today, our medical colleagues, they put 100 kids on B6 with ADHD, what's going to happen?
7.
I'm sorry?
10.
Maybe 10. There's just going to be a few that are going to respond. So we're going to throw it away and never treat those few. What hopefully I'll share with you today is that we can test, we can look for markers of B6 deficiency in the blood, in the urine, in the hair, And if we know that's part of what's going on, either genetically or nutritionally, then maybe B6 is going to be one of the recommendations for your child. Well, so that's our B6. And the other really important piece of how we make dopamine in the brain is for dopamine to actually hang around longer to do its thing. So there are a number of herbal compounds, I only talked about a few, that can actually help regulate dopamine in the brain. And the one that we use most for ADHD is something called rhodiola. How many people have heard of rhodiola? Wow, enlightened group. So you've been hiking in the Siberian mountains. So rhodiola has been used for a long time, but there's been clearly some studies looking at attention and cognition with this herb. I have not found it incredibly helpful by itself in young kids. I have found it a nice adjunct and particularly helpful in adults. But I want to get to what's a little more fun to me. So one of the supplements that I've been working on with Pure Encapsulations, who is a nutrition company that's been around for a long time, who's actually sponsoring this seminar. So on your way out, you should say thank you for providing the room and the refreshments and the opportunity for me to do this. But we've been working on simplified supplements for our kids with ADHD because, again, as I share with you, my job is pretty easy. I do all these tests and I say your child needs these 20 supplements. And parents just look at me and they, either say yes and they call me screaming the next day, or they just get frustrated because we can't give all these kids all the supplements they need. So working on supplements where we're combining all the most helpful ingredients. Here we have our B6. Here we have our precursor tyrosine, the folate, the zinc. We're going to talk about the rhodiola. But what I want to talk a little bit about is grapeseed and green tea. And these are ingredients that I've been using for over 20 years. Actually, it was in 1993, someone walked into my office with a powder of grapeseed and green tea and said, "This cured my child with ADHD," and I kind of laughed. And she kept coming back, and finally we started looking at these products in 1993, and it was shown to be incredibly helpful. So the active ingredient in these kind of herbs are called OPC, and I'll only say it once because it's hard for me to say. Oligomeric proanthocyanidins. Did I say it right, Kelly? So OPC, okay? And this was discovered a number of years ago as they were looking at some of the positive effects of red wine, and what were the compounds in red wine that it was called the French paradox. Why did some of the individuals have drinking red wine, eating all the fat, perhaps it lowered cardiovascular disease. But what we were able to demonstrate is that OPC had a huge effect on ADHD, certain kinds of ADHD. So now we need a little neurology lesson, and then we can take a break. So let's do this first. How many people, you've heard the TV commercials for alpha waves. What do alpha waves do in the brain? Somebody. You relax, right? So all these meditation, you put the CD in, you're going to have alpha waves. So if you are relaxed or if you're meditating, you're going to produce a lot of alpha waves. How about if anybody's paying attention today, you're going to produce a lot of beta waves. So beta waves are those short brain waves that help you pay attention. And how about those that are thinking about what they're doing this afternoon, or what their kids are doing, or those are those daydreaming brainwaves. If you're not paying attention, if you're sitting in the class thinking about what you're going to do after school, you're producing a lot of theta. Thank you. So for years, we would look at this ratio of theta to beta, and it's actually proven to be one of the most accurate predictors of ADHD. It's still getting some publications. No one's, some people that are doing neurofeedback are looking at it. But the ratio of theta to beta waves are really important. So we know that ADHD kids produce more theta waves. Okay? Makes sense. Kid is distracted, producing more theta waves. So here's what we did. Well, one, people started writing letters. Pycnogenol is pine bark, is another source of OPC. So American Journal of Child Psychiatry, really well-respected academic journal for child psychiatry. So they started writing some letters. So I said, wow, we can kind of submit what we've been doing. So then the next year we wrote into the journal. It was published about the studies that we've done. I'll show you in a minute. But whenever you have a positive nutritional study in a traditional journal, they always need to have an editorial disclaiming the results, saying that these are interesting, but, and you see it all the time, whether it's a fatty acid or a vitamin, no matter what the results are, there's always got to be an editorial saying, please be careful with this nutritional supplement. They never say that when they come out with a new medication that might be taken off the market in 6 months because 200 people have died. But a positive nutritional study. So we got published, but then they had to say, but you should be careful about taking this nutritional supplement. This is some of the pine bark research, but I want to get to some of the stuff that we did in the 1990s. So you got to be a little color coordinated here. So remember what theta waves? Daydreaming brainwaves, okay? So Johnny, age 13, we have studies with kids and adults. This was baseline, just kind of staring at the computer. Then we asked Johnny to read. And then we asked Johnny to listen. Now, if you and I, hopefully, started reading a book, what would we do? What brainwaves would we start producing? Beta, right? So beta would go up, which is the yellow, and our theta would go down because we were reading the book. But if you talk to any of these ADHD kids when they're sitting in front of their history book or their math book, and they go down and look at the book, what happens? It actually, not that they can't even pay attention, it gets worse. The theta waves just go up. Okay? So baseline. Read a book, theta waves go up. Listening, so this, we learn a little bit about auditory processing. This individual was able to listen better than to read. So we gave them, sprinkled a little OPC dust, okay? And here's what happens with the same individual. Baseline, on the OPC, about 6 weeks, his theta waves came down. Okay, so that's my OPC story. There's lots of literature, not lots, there's a good amount of literature looking at pine bark. It's more expensive than grapeseed extract. That's why we focus on grapeseed, green tea, red wine. And you also get OPCs in our blueberries and all of our dark fruits. So we're working on a supplement to kind of help simplify it, but the nice thing about the Dopa Plus is that we do have 100 milligrams of grapeseed extract in that. Okay, so I think 10 o'clock we should take a break, and then we'll come back. Why don't we just take a couple questions about either the OPC or what we just talked about.
And OPCs presumably would be as effective for adults as for kids and adolescents?
Okay, OPCs. Let me give you the full story. I think OPCs are much more effective for the inattention part than the hyperactivity part. But some of the earlier research showed improvement in both. And so I actually find it more effective in adults. Because sometimes it's not enough. For some of these kids that are severely impaired, they still might need medications. But hopefully all the tools I'm going to share with you are just going to simplify the medications, decrease the side effects. So for adults, oftentimes the supplements, the OPCs, are all we need. For some of these kids that are more impaired, we might need those with medication.
Is it possible for a person to have an adverse reaction or an allergic type of reaction to an OPC, like a red wine or a grape seed or anything like that?
Good question. For any nutritional supplements, you could have a side effect. One of the nice things, the reason that we're working with Pure, hence the name, is it's one of the best companies in terms of avoiding some of the additives and fillers where we find most of the reactions are. So rarely are we going to get a side effect to some of these nutritional supplements, but anybody could have a potential side effect. The kinds of things that truly amazes me, I have patients, particularly adults, they're taking 6 medications, right? For blood pressure and heart disease and depression. And they come in and they take vitamin C from me. And they're having side effects. And they're calling and thinking it's the vitamin C. Not that the PCP just increased their blood pressure medicine or all these other things. So people, our culture is so medication oriented that people are sometimes more frightened of the supplement than they are of 6 medications. Clearly, and we can go through some of them, but the short question for OPC, I've never seen a side effect.
When you're working with an adult with ADHD using Dopa Plus, for example, how do you titrate up or down the dose? Do you use repeated testing or just symptom history?
Okay, let me think. No, I'll go through that now. So to Dopa Plus, I would start slow, 1 pill twice a day for kids or adults. The most I've gone up to is 6, usually end up at 4. And it's the kind of supplement, like most of the things we're talking about, that, I'd give it 2 to 3 months. If they don't notice a difference, I would not continue to take it. Some of the nutritional components of the Dopa Plus might be helpful, and then we would just adjust that. But if we're not getting an improvement in mood, attention, then I would not take it longer than 3 months. We might continue to take OPCs or magnesium, but in terms of trying to get an effect of enhancing dopamine with the tyrosine, that is 2 or 3 months. And before meals, you want to kind of use it on an empty stomach. It'll help you absorb it better without any interference with the food that you're eating. So it's usually 4 to 6 a day.
And the other product that you use, I think it was for anxiety, same thing, you titrate it up?
Yes, for all the supplements. We'll go through those at the end.
You said it was a capsule, so for a child who's not swallowing a pill, can you open it up and sprinkle it on something? Or?
Yeah, I would not use the Dopa Plus in anybody under probably 8 years of age. I mean, without an evaluation, I might, but I wouldn't recommend you guys use it, without testing.
We use PRN as needed.
For the Dopa Plus,
For the Dopa Plus.
I have not found it to be that helpful.
Okay. Continue with, like, for a college student that uses Adderall twice a week or something.
No, I don't think they would get, now rhodiola, taking some of the ingredients out, like a couple 100 milligrams of rhodiola, people have noticed they do better that day. Magnesium, they'll do better that day in terms of relaxation, but I wouldn't use Dopa Plus like that. I would take out some of the ingredients. Last question, we'll take a break. Go ahead.
Is the testing very expensive? You say a lot of testing to find out about allergies or whatever is going. Is that expensive? Is insurance pay for that, or?
Good question. There's some information out at the desk. Again, when I started, it was $2,000 or $3,000. Now it's probably hundreds of dollars because insurance pays a chunk of it, and for most of the kids testing, we're using a lab called Great Plains Lab, so some insurances are covering all of it, but a lot of people can get most of the testing for a couple $100. I think that the battery for an ADHD child, for everything that I would like, is maybe $600. But oftentimes we can pick things up with smaller amounts. Okay, let's take a break, and the people at the desk can answer some more questions for you. Answer some of the questions. I have some questions here that I'm sure I'll leave time for. Okay, so when we ended, we were talking about medication treatment and utilizing stimulants, right? Ritalin, Dexedrine, Adderall, Concerta, all these amphetamines, and what do they do in the brain? What? Beta waves increase attention, and they kind of optimize the function of dopamine, right? So that's the good news. But what happens if you have too much dopamine? Speed, irritable, angry, aggressive, and dopamine goes on to norepinephrine. So When we get those two neurotransmitters a little too high, one, plus the side effects to some of the medicines, but it's also that irritable, angry, aggressive feeling. I quickly went over that HPA molecule made from Clostridia, which causes you to make a lot of norepinephrine, which makes you irritable, angry, and aggressive. And the most common thing we see in young kids with ADHD who are poor responders to medication is elevations of copper. Why? Because you need copper for the synthesis of dopamine to norepinephrine. So if we keep driving that, we get more and more dopamine and norepinephrine, and we get this irritable, agitated state. It's a simple test. We do blood tests. We look for the protein carrying copper. We look for hair levels of copper, and we can assess elevated copper. It is critical. One, as I said, these are the kids that don't respond to the medication. Not only don't they respond, these are the kids that actually get worse. What happens if you're driving the dopamine system? You have a lot of dopamine and norepinephrine due to high copper, and then you add more. These kids get worse on amphetamine. Okay? Number two, these kids typically are very aggressive. These kids have lots of allergies, and these kids have a whole host of other physiological problems. And the treatment is relatively simple. And the treatment is, what do we do for high copper? Zinc. But without adequate zinc, copper just continues to accumulate, and it really wreaks havoc on behavior. This was just a fascinating study to me in one of my traditional psychiatric journals, where it's CNS spectrum. And it's just kind of typical of my profession. Ready? 21-year-old, bipolar 2 and ADHD. 8-year history, not managed well by medication. They said blood tests were all normal. They said other than her copper level, which recommended levels were within normal limits. So they had low copper. And so the confusing part when we look at some of these trace minerals, low copper is sometimes just as significant as high copper. And why would that be? Because if you have low copper, you can't adequately synthesize dopamine and norepinephrine. So here, I don't know if I have the next slide. Well, the punchline of the study is they gave her copper, or they gave her a multivitamin with high doses of copper, and she got better. And then they took away the multivitamin with copper, and she got worse. They put her back on. They did not mention, copper was the issue. But clearly, low copper and high copper need to be assessed for ADHD, particularly the aggressive kids that don't respond to medicine. Zinc, there probably isn't more. There's probably not a. No, I think I'll take it back when I talk about magnesium. There are many trace minerals that are important for ADHD that we're going to talk about. Zinc being very common. Zinc, for many of you know, is a big part of the work with our eating disorder patients because they restrict intake of meat and they have higher needs for zinc. But we primarily get our sources of zinc from animal products. And zinc is shown to increase serotonin uptake. It's important for the synthesis of melatonin, which helps regulate sleep, which then helps feed back with dopamine. So low serum levels of zinc have been associated with depression. And then I'm just going to jump to zinc. This I just put in because it was a recent study from this year, a summary of all the research. But here's, let's save the animal studies and just go to the humans. So 4 different studies looking at a trace mineral, zinc, and its relationship to ADHD. And many of these started, these are all 1990, but I was reading about this in 1980. Okay? So zinc levels predict stimulant response. Lower serum levels of zinc, they responded better to the stimulants. I don't know if they still do it, but it was in Iran, I believe, where they added zinc to the amphetamine preparation because they knew they worked better. Okay? If they look at ADHD kids, those ADHD kids had lower levels of zinc. There was one study looking at zinc as effective as a stimulant, and other studies looking at zinc for the hyperactive and impulsive behaviors. These studies aren't great because they don't really look at copper and other associated pieces, but zinc is a very, very common micronutrient that we see deficient in kids with ADHD. We test for it from the hair, and we also test for it from blood, as well as some functional markers in the urine. Again, it's one study looking at zinc, and the mechanism, we don't really understand. Most of the enzymes in the brain are zinc dependent, but I believe it probably has to do with the disruption of melatonin, and we're going to talk in a few minutes about ADD actually as a sleep disorder. So the dysregulation of melatonin probably has a part to do with it. And here was just one study looking at parent rating scales. Here's the Ritalin with the zinc, which showed decrease in the symptoms of ADHD. Another trace mineral that has lots of confusion is iron. You also need iron to make the neurotransmitters dopamine. And again, this is just a summary of 3 studies. Iron decreased symptoms of ADHD on a checklist. One of the blood tests that we do is called a ferritin level. That's the carrier. That's the protein that carries iron around. So this study shows that 84% of kids with ADHD had lower ferritin levels. And another study looked at ferritin levels correlated with hyperactivity. So when we think about ADHD, I mean, most of the time I don't really see it as a vitamin deficiency disorder. It is more like a trace mineral deficiency disorder, if you put all the literature together. So iron is a nice segue into sleep. Because how many people have heard of restless leg syndrome? Okay. So restless leg syndrome is a really disabling syndrome in some adults, but we certainly see it in kids. We know that iron deficiency profoundly affects sleep, and it's a treatment for restless leg. Oh, this was supposed to be my coffee break slide. I missed the time. Anyway, supposed to represent, here's the 5% people who actually like coffee, 95% people who like a truckload of cream and sugar in it, looking at the genetic differences of how we metabolize caffeine. Just like the genetic differences of how we metabolize all the nutrients that we're talking about today. So when we get to sleep, which is going to be the punchline this afternoon, one of the, again, common deficiencies we see in these ADHD kids is the trace mineral magnesium. Okay? And I'm going to skip many of these slides, but the punchline is magnesium is very difficult to test for, because most of the magnesium is in the cells, in the bones. So blood levels are not accurate. Hair levels, trace mineral levels of hair tend to be the most helpful way that I've ascertained stores of magnesium. If we look at why I believe it is the most common nutritional deficiency on the planet, but certainly for our ADHD kids, there's a couple reasons. Hopefully we can pass over alcohol, caffeine maybe, but soft drinks causes tremendous the phosphoric acid depletion of magnesium, and then stress causes increasing cortisol and depletion in magnesium. Where do we get our magnesium-rich foods? It's certainly not the junk food and soda that we're feeding many of our kids. So it is the most common deficiency. There are lots of magnesium-associated symptoms. Many of them are kind of vague, but one common expression that I've used for many, many years. If it's spasms, think magnesiums. So any kind of disorder, whether it's irritable bowel or asthma or migraines, we think of magnesium deficiency. But in a mental health practice, there are a couple of things that are what I call pathognomonic for magnesium deficiency. Okay? A child complaining about constipation, insomnia, irritability, and anxiety. I mean, those four, 3 out of 4, 2 out of those 4 are very, very commonly associated with magnesium, and we watch all those improve pretty dramatically with magnesium supplementation. And again, these are some of the early studies looking at magnesium deficient. 1997, 95% of ADHD kids had low magnesium, and here's 50 kids, 6 months of 200 milligrams of magnesium, decrease in ADHD symptoms. If you ask me, if you had a child or a patient, one intervention to do on your own without any testing would be 3 months of magnesium supplementation, by far. The simplest and the easiest. You get some regulation in hyperactivity, impulsivity, and certainly sleep. Okay. Before we get to sleep, the other important thing about magnesium that we see is treating the side effects to the stimulant medication. So what are the side effects we see if we're using amphetamine on 6-year-old children? Anybody? Insomnia, agitation, decreased appetite, irritability. How about the nail biting, the picking, the tics? Okay. Almost all of those, except for the appetite, will go away with magnesium. Okay. Been doing this for 25 years. Okay. The side effects to a lot of the amphetamines are due to magnesium deficiency, because another cause of magnesium deficiency is taking amphetamines. Okay? As you take the stimulant, your body is depleting magnesium. So these kids that take the stimulants for 6 months, they don't have any problem, then they start developing the tics, or the hyperactivity, or the irritability, or the nail biting. Those all go away with magnesium. So another simple intervention that our integrative colleagues hopefully will start doing is, why wouldn't you take zinc, because we know the amphetamine works better, and magnesium with the stimulant, if you're feeling this child needs a stimulant. Sleep. Sleep is a problem. The amount of sleep we're getting as adults are going down each year. Major expense, major input for the pharmaceutical industry, as well as disruption of life for many of our patients and those that aren't getting help. I want to share a little bit about attention problems related to sleep, but I think the literature is getting clearer and clearer that there are major implications of sleep deprivation. I think the most pervasive is what we call inflammation, disruption of the immune system that contributes to a whole host of chronic illnesses, digestive health, weight gain, diabetes. Let's focus on ADHD and mental health. I believe this is one of the most important things I can share with you today. For some kids, sleep deprivation doesn't cause lethargy. So maybe day one, Johnny or Susie is tired. They didn't get enough sleep. But our body has this incredible ability to adapt. So you can't say that because Johnny or Susie is not tired, that they're not sleep deprived. Make sense?
Yes.
Okay. Did I work it out? So for some individuals, particularly kids, adults usually are going to be lethargic for a lot longer. But these kids, they just can keep going. And then they get in this chronic state of sleep deprivation, which I believe creates a whole host of metabolic problems. And there's now some good literature. This is New York Times. Could what looks like ADHD be a sleep disorder in disguise? How many people have heard about the relationship between sleep problems and ADHD? Okay, a couple. I mean, it's really significant. I don't know if it's always the cause, but it's a contributing factor. And here's kind of what we know. There are many, many studies looking at this. Not a lot of people have translated it to clinical work. This was 5 to 7-year-olds, those that snored. Again, 5 to 7-year-olds with snoring or sleep problems, twice the incidence of ADHD. Kids that snore, worse in attention and overall intelligence. These are 3 different studies looking at a whole host of other sleep disordered problems associated with attention and overactivity. And this is one I wanted to get to, which I think is the most dramatic, and it begins to kind of put some of these things in perspective. So 11,000 kids followed in Britain, and they were looking at 6 months of age. Did your child have sleep problems at 6 months of age? And then they followed these kids, and look at the incidence of ADHD, or not diagnosed, but attention behavior problems. By age 4 and by age 7, 20 to 60, 40 to 100%. Okay? So the question is, could early infant breathing difficulties kind of create a more permanent neuropsychiatric change that contributes to this abnormal metabolism of neurotransmitters, if you will?
What causes the abnormal breathing?
Could be a whole host of problems. For many of these kids, they just took out their tonsils. So there are studies looking at ADHD symptoms before and after tonsils. I don't think there's been research, but I could share you probably a subset of these kids who are allergic to dairy or other foods. Okay, so underlying cause not looked at in our medical world, we just look at symptoms. But the correlation is pretty significant as sleep disorders, attention problems, and my message is lethargy and fatigue doesn't necessarily mean they're having adequate sleep. And to be even more dramatic, so our list of diagnoses, which keeps changing every few years, right? You've heard about the new DSM-5. So it's coming out or came out. For only $250, you can find out what the new diagnoses are. So when one of the versions in 1980, excessive movement in sleep was actually a criteria for ADHD. But it kind of lost favor, so in 1987, when we stopped combining ADD and ADHD, there's no mention of sleep disturbances. But it's a very common comorbid problem with these kids. So, sleep. I just want to kind of end a little bit about helping us think about helping these kids sleep, which I think could be the most significant intervention that you can often do on your own. We talked about protein being the source of amino acids to make all the neurotransmitters in the brain. We talked about tyrosine helping us with dopamine. But there are other ones that help us with sleep, and we're going to talk a little bit about glycine and tryptophan. So to make melatonin, we need to eat protein that has tryptophan, which means we need to digest it, and then we need our folate, our zinc, and B6, and then we need adequate zinc to make melatonin. Melatonin, I think, is an incredibly wonderful nutritional supplement. I just have some problems sometimes with the dosages that we're using, particularly with our kids, because melatonin is a hormone. And there might be some research on high-dose melatonin for cancer and other things, but to help somebody get to sleep, you do not need, I don't want people, I think the lowest you can get sometimes in the health food stores are now 5 or 10 milligrams. But the original studies were 0.3 and 0.5, and they work. And oftentimes, if you're working with a patient, you start going up, the sleep effect wears off. So I'm a believer of lower dosages. I rarely for sleep in ADHD kids who want to get above 3. Again, the culture more is better, and parents just keep going up. And the truth is, at 30 milligrams a day, which is recommended for some cancers, that our blood levels rise 30-fold over normal at night. And I don't know if we know what that is doing. So low doses of melatonin. Pure has both liquid, which oftentimes I think is a little more effective than the capsules, but try to stick with under 3 milligrams for sleep. I believe one of the most helpful nutrients I've used for sleep over the years, and particularly for some of the ADHD kids because it's calming, is the amino acid glycine. And again, I'm going to go through. It's simple. It's over the counter. The nice thing is it actually tastes kind of sweet. So you can open a capsule and put it under your tongue. Or you can take a capsule, and there's actually a growing number of research studies looking at glycine as a sleep aid. And one of the nice things, again, it doesn't disrupt normal sleep architecture. Okay? When we talk about medicating, someone in the room earlier came up to me as a 3-year-old child that was put on clonidine to help them sleep. Now, clonidine, the benzodiazepines, and a lot of the medications we use affect the normal sleep architecture, which means you might be in the bed sleeping, but you're not going through all the normal phases of sleep, restorative sleep. Glycine does not do that. Here's a liquid supplement that has our glycine, our theanine, and GABA. That's been very helpful. Actually, a crew of my staff had tried it a number of months ago and found it incredibly helpful. Again, oftentimes, I'd say a small subset of ADHD kids get a little agitated on the GABA. You would know that quickly, and then I would just use pure glycine.
Yeah, say it like if you could.
Magnesium, glycine, melatonin. These kids are going to sleep better. Sleeping better is going to be a huge step in getting both the therapy and the other things. Okay. The last supplement I want to talk about is kind of amino replete. Many times we talk about any of the neurotransmitters in the brain, those that help us pay attention, dopamine, those that help us relax, GABA, glycine. Those are all based from these proteins that we get from our diet. Too often these kids aren't getting adequate protein on their diet, and as these kids get older and the adults aren't digesting protein adequately. So the most helpful supplement that I've used over the past 25 years has been powders work better than pills, what we call free-form amino acids. There's no digestion involved. It's absorbed very quickly. And it's been the most helpful to me working with patients to regulate fatigue, mood, and attention. It does not help you sleep, so you wouldn't give it to someone at night. It's kind of stimulating. It's a little energizing. But for too many of these ADHD kids, their ability to focus is not there. And if we're avoiding a medication, I would usually use something like this with something to enhance dopamine, like the Dopa Plus or Tyrosine. Okay, quickly through, yes?
Is that if there's a deficiency, or is that something you would just automatically get?
We don't usually see a deficiency in kids. Occasionally we do with these very picky vegan eaters. We look at levels of amino acids and they're all low. And for adults we see deficiency. So oftentimes I don't even do the testing for kids. That we would just use the stuff. And again, oftentimes the goal is to get most of our nutrients from our food. And as these kids start eating better, we really can minimize a lot of these supplements. But usually when they're presenting to us, they're profoundly disabled by their symptoms, and usually their diets are quite poor. And as much as Charlie and the dietitians can help counsel parents, it's not easy, as we know, to rapidly change a diet of an adolescent or a young child who's living on junk food. Or their kids, their friends are all living on junk food, and you're telling them to bring their broccoli spears to lunch. Okay. How much has our no-fat, light, skim,
Would you still recommend a magnesium supplement even if your blood magnesium levels are within normal range?
Yeah, the magnesium with symptoms of ADHD, and usually we use the hair, be the most accurate measure. But most of the time, magnesium we would supplement regardless of testing. This is no good test because 99% of all the magnesium is stored in your tissues and your bones and your cells.
And do you do the 200 milligrams in one dose, or do you split it up?
For a kid, probably like 120 twice a day, 200 to 300 total during the day. So how much is our no-fat, skim, low-fat, skinny, what else, sugar-free, done for our obesity epidemic? Right, pretty frightening. Things are worse. And I believe it's had profound implications for the rise in mental health problems in kids and adults. So these are 2-hour lectures that I won't go through, but in terms of depression, psychosis, all of our major psychiatric illness, we have good research to look at low levels of essential fatty acids. So I like the facts of life. I stole that from somebody else. Just giving a seminar on life. But anyway, 60% of the brain is fat. These fat molecules hold all the receptors in sight. Yellow is cholesterol. The rest is these omega-3 and omega-6 fatty acids. Without adequate, healthy fats in the brain, you're not going to be able to get the dopamine to do its thing. Okay? It's the substrate for everything in the brain to work adequately. What I want to share briefly is one part of fat is low cholesterol. How many people know about low cholesterol in relationship to mental illness? So it's not that common. My life got better when the FDA put a little warning now on statins, saying cognitive and memory problems. Since most of us have been saying it for 20 years and people are looking at us like we're cross-eyed. But low cholesterol is a big risk factor for depression and suicide. And the reason that I throw it in here is because we have a subset of very, very aggressive ADHD teenagers that have very, very low cholesterol, total cholesterol of 90 to 110, 120, and that when we treat the cholesterol, that ADHD goes away. And these are aggressive, sometimes violent ADHD kids. So cholesterol is critical for brain function. This is just, when we talk about substance abuse, looking at low cholesterol and cocaine relapse. Low cholesterol values in patients who relapse 3, 6, and 12 months after discharge from treatment. So low cholesterol needs to be checked in all of our, particularly our aggressive, hyperactive ADHD kids. Large doses of fish oil are very good for your heart, especially when you have the urge to swim upstream. And that's what I was getting to here, that the omega-3 fatty acids are critical for brain function. Like lots of us, when we think about medications, people want the quick fix. So they go out and they go to CVS and buy a fish oil pill, and they might take the bottle, and my kid is not better after a month. So fish oil doesn't work. This is just one study. We say it takes 3 months to change your oil. So 10 weeks for cerebral membranes for these polyunsaturated fats to replenish itself in the brain. So the fish oil is not a quick fix. I have seen some high dose pure liquid fish oil that kids have gotten better in a week or two, taking 3 to 6 grams. It's not common. Most of the time it does take a few months. Certainly it's not the quick fix that a lot of the parents are looking for. In the work that I do, kind of keeping a medical model, I do testing for essential fatty acids, so we can look and find out which kids are very deficient and then know how aggressive we need to treat. My preference for the kids with ADHD, there's such a controversy in the studies. Most of the studies have demonstrated some improvement. We know that kids with ADHD have lower levels of omega-3 in their red blood cells. Some studies showed positive, some studies showed negative, some studies showed omega-6s for kids with ADHD. There is some of the better research that it was only the omega-3 and omega-6 supplements that showed improvement. With testing, again, we could pinpoint. So Some people talk about high DHA, high EPA. Do we use supplements? Do we go to CVS and get our fish oil? No. You want to be really careful and understand how it's processed to remove some of the toxins. You might be able to get a vitamin C from CVS, but please don't get fish oil. Krill oil is, I think, a wonderful supplement. It's a well-balanced essential fatty acid. If I'm treating someone with ADHD and I have low levels, I prefer to use the high-dose fish oil first, and krill oil is more maintenance.
And Pure Encapsulations has a wonderful ultra krill.
Pure Encapsulations has a bunch of wonderful products, yes. Questions?
Yes, with zinc, I've read in the prescription for nutritional healing, perhaps, because I've read it in several places, not to take zinc every day. And a typical formulation is 50 milligrams. Could you
Okay,
comment?
let me make a list of questions. So I'm going to stop in a few minutes and then we'll go through questions. But let's finish our, so zinc dosing. So we can't miss my favorite slide. Low fats diet don't work. I eat fish every day, but my butt still grabs on the Okay, so we did the fish oil, and this is really, I think, captures a lot when we talk about healthy fats. By modifying natural fats, we've altered the basic building blocks of the human brain, weakening cerebral architecture, and like unstable buildings that come apart in an earthquake or storm, poorly structured human brains are failing to cope with the mounting stress of human life. So, I didn't put it in here, but I've been repeating this slide in every talk that I give, so I got to say it again. Omega-3 fatty acids. We had a group of young adults who had what we called subthreshold psychosis. Okay, they had a period of psychotic episodes and very high risk for developing psychosis. There are people around this country who are recommending that we use antipsychotics to prevent psychosis. So 1.2 grams of fish oil, 1 or 2 capsules, prevented the onset of psychosis in this high-risk population. Published in the most academic psychiatry journal we have, Archives of General Psychiatry. 1.2 grams of fish oil prevented the onset of psychosis. It was 5% in those who took fish oil, I think 40% in those who didn't. Dramatic difference from a little fish oil pill. Never got on the front page of any magazine or newspaper, never been replicated, and it was that same thing I told you about. There was an editorial in this journal saying we should do more studies before we recommend fish oil for our kids. Okay, profound effect in the human brain. Okay, here's the fun part. Parents versus research. How many people think sugar causes hyperactivity?
Good.
A few. Well, clearly, part of the issue is kind of moot because, refined sugar, whatever it does, is not healthy, and I call it a nutritional vacuum cleaner, right? Depletes nutrients, and it's going to have some effect down the road. But I don't know why we're wasting so much time and energy and money, or we did in the 70s and 80s, but does sugar cause hyperactivity? And the research is pretty clear. No, with that same 100 people in the room, you give them all a candy bar, guess what? They're all not going to be hyperactive. So we have all these fancy studies, 12 double-blind placebo-controlled studies saying, oh, don't worry, give your kids sugar. It doesn't cause hyperactivity. It might cause heart disease and cancer, but it's not going to aggravate your hyperactivity in that few hours that they follow.
Wouldn't those kids have a high threshold, they're already going to have a high level of sugar in their system almost all the time? I know it's metabolism. I'm just saying they're always having a lot of...
Well, we're getting there. We're on the same page, so let's keep going. Okay, so there was an early study that I think has been never repeated, but really quite, I think, important. So they looked at attention after they gave individuals sugar and a carbohydrate meal. So if you ate sugar, it was a sugar drink, and then they asked you to do a test, and you didn't have anything, it was not significant difference. If you gave sugar drink with a donut, you performed more poorly. If you gave them sugar with protein, they actually became more attentive. So the protein minimized the effect of the sugar in this one study. But more important, there's been a couple studies looking at just glucose metabolism. Okay, glucose tolerance tests, how we metabolize that sugar drink, which I think was what you were talking about. What happens to our blood sugar? And most of the studies showed that the kids with ADHD had abnormal glucose tolerance tests. So this is a woman who sent me her PhD thesis. I don't know her name, but she had, I think, 80 ADHD substances and did glucose tolerance tests on all of them. And if you look at these examples, the ideal range is here, that what she found is that they were almost all abnormal in some respect. They weren't all consistently abnormal in the same way. The typical pattern is someone goes way up and then spikes down. Okay? And then we have other studies to support it. So kids with ADHD have early onset of difficulties metabolizing refined sugar. And there's one brilliant study that I don't have here by a physician, I think it was a pediatrician at Yale, who gave these kids a sugar drink and then was able to demonstrate as the blood sugar dropped for those with ADHD, they weren't able to produce enough norepinephrine, which we make from dopamine, to regulate their blood sugar. So not only did he get the abnormal curve, he looked at the hormone levels to show that they weren't producing sufficient norepinephrine to regulate the blood sugar. So there's clearly some pretty significant effect of metabolizing sugar and ADHD. So hopefully, I'm going to kind of wind down and we'll take questions. We could spend a day on all the possible things we look at for ADHD, but I hope we can see this not as alternative medicine, right? Integrative medicine is the word. And here's my summary punchline. These were prisoners in England. And again, one multivitamin supplement. This was an over-the-counter multivitamin supplement that you could get in London at the time. And there was a couple essential fatty acid pills. And it was omega-3s and omega-6s. They had double-blind placebo-controlled trial. They gave it to prisoners. And they didn't know what they were getting. These vitamins are placebo. And in 4 months, look at the difference. 35% reduction in disciplinary offenses and 37% decrease in violence. 4 months, 3 pills. Over the counter. I mean, think of the public health implications of working with our prisoners, and then, you know, think about what an impulsive, aggressive ADHD kid who flunked out of school. I mean, where are they potentially going to end up? In prison. These were 2 studies that we found from the 25% 1993 ADHD in prison populations, 40% in adult male longer-term prison. So the question is, does ADHD cause one to become a criminal? The answer is no. Does taking stimulants cause individuals to abuse drugs? And the answer is no. The research is actually pretty clear. Untreated ADHD is a risk factor for using drugs and having substitute drugs. Untreated ADHD is a risk factor for juvenile detention in prison. So, you know, as I started, the name is meaningless to me, but they have ADHD or not. And I think Carl gets this a lot where parents come in and they want a name for a diagnosis. And oftentimes, the name is not as meaningful as a list of symptoms, how they're learning, how they're processing, are they impulsive or not. So I don't care if they meet the checklist, but I do care if these symptoms are impairing some aspects of their life, because if it is, we all know that they are going to get in trouble. If it's not just giving up on school, regardless of how smart they are, it's starting to use drugs, etc., etc. and we're just going to go from there. Okay. Our last point is lithium. It's a medication, right? We use it very high dosages for bipolar illness. It is a miracle drug in psychiatry because it works, and it works well. But it is also a horror story of psychiatry because it causes significant kidney and thyroid damage. We have patients who did well on this medication that had to stop it because of kidney damage. And I bring it up here because low-dose lithium has been a really important adjunct to our treatment for ADHD. Okay? So when you think of ADHD, if you add the word irritability to it, anger, irritability, think of lithium. So we see it in substance abuse. I've had a bunch of road rage guys who are completely cured, and this diagnosis bipolar 2, which doesn't mean anything. So let me just share a story of Peter. Young kid got kicked out of preschool. Okay? How many people have heard of kids getting kicked out of preschool? Well, I'm hearing it more and more. It's a little frightening. So, mom was super mom, so we got dairy, had the high casomorphin, got rid of dairy, and things were better. Not dramatic, but better. And then we did the hair test. And the hair test I shared with you was good for copper, magnesium, and zinc. And we had no detectable lithium. No detectable lithium. There's lithium in our soil. There's lithium in our water. I believe one of the problems now of drinking all this bottled water might not be getting some lithium. I'm seeing this more and more. Anyways, so tiny drops of lithium. This kid's back in preschool. Okay? And I just spoke to a mom who was treating a kid in upstate New York. The same thing. ADHD, irritability, aggression, a few drops of lithium made a huge difference. So ADHD and irritability. We think of high copper, we can think of low lithium. So, my wife left. But anyway, we got a puppy. So now we're up to 8 months. But it was both refreshing and frightening to me that the pet stores have healthier food than the stores that I buy, food for my kids. Okay? I mean, every aisle is organic and grain and raw and, New Zealand. I mean, these dogs are eating wonderfully. I mean, it's truly amazing. I feel so good that I can get my dog organic food. But it's hard, to take my daughter out to a restaurant with her friends and, argue about the milkshake and fries. But anyway, if we could feed our kids better, we would make a huge dent in this disorder. Part of what I'm here again to say is that this is not a behavior disorder. Okay? I really need you to get this phrase. And it's a medical disorder that affects behavior. There's something neurochemically going on. It could be genetic vulnerability, having not enough D2 receptors or not producing enough dopamine or whatever the genetics are. But there's a neurochemical abnormality. So that's why I need you to say it's a medical disorder, but that neurochemical disorder affects behavior. It affects how you listen. We talked in the old days, parents used to, well, I think we still do, but not as much, punish our children, right? We can't do that anymore. But with an ADHD child, how well does punishing work? Pretty poorly. You start taking things away, it's meaningless. And I swear to God, I had a parent come to see me in Norwood when we had this ADHD clinic. They started taking things out of their room, and they came to see me, there was just a mattress in the room. They were trying to punish the kid. But this child's brain was unable to control the behavior. So punishments, a candy, a trip to the ice cream store, that might work for 5 minutes. And maybe we all see these kids doing really well the first semester when you start saying, I'm going to give you $10 for an A, or the first period. So yes, there is some sense of extra dopamine, and they're going to do it. But it's going to peter out. And these ADHD kids are just going to kind of fall back. So we need to treat it medically, and hopefully we can do it with a biomedical model, which is what I started talking to you about. Some people asked about the testing, so we can look for all these things in a simple urine test. We can do blood tests, and then we can get even fancier and do, other tests to see is there something going on. A family shared with me at the break, they have a 3-year-old whose child was diagnosed bipolar. And I will share with you, emphatically, there's no such thing as bipolar disorder in a 3-year-old. Okay? Now, if you go to Mass General, they're going to diagnose any angry child who's aggressive with bipolar disorder. And I can't tell you that child might not develop bipolar disorder, but this is just a tragic story. I don't know how many people have heard of it, but a 4-year-old placed on Depakote, clonidine, and amphetamine, and died from an overdose. Okay? So the most important thing I can share with you, and that's why we're going to actually start talking about autism and treating autism aggressively, because when we look and treat these kids, certainly under the age of 6 or 10, in my experience, I'm 95% sure we can make a huge difference by some of the things we talked about. I can't say that for a 12, 18-year-old, kid, but I can emphatically say if we look for these young children, there's something contributing, unless there's trauma or abuse. A kid that is kicking, biting, screaming, punching, getting kicked out of preschool, unless they're being beaten, there's something biochemically disrupting their neurotransmitter system, and we can usually figure it out. I'm going to summarize my reading of the literature.
ADHD.
What?
Behavioral stuff.
Yeah, here's my reading of the literature. I think it's fascinating. What do I have for studies? But here's what I'm taking home. Thank God I don't have a young child anymore. Based on what I'm reading, I certainly would not be putting the 0 to 3-year-old in front of the set to calm them down for long periods of time. I think that literature is pretty clear. I fought for years about parents telling me, like punishing, get everything out of the room, restricting the video games and restricting this. And I have not, there's some correlation, but I don't think that's the answer to the ADHD problem. Certainly, the TV trains our brain. I don't know what the average length of each screen, but we're talking about seconds. So it does disrupt our ability to focus and pay attention. And if I had a young child, I'd be really careful about those early years. I'm not as worried about the 7 or 10 or 12-year-old, because taking the TV away or not is not going to make a difference. Treatment, not all kids need to take stimulants. They don't cause substance abuse. We've proven that. It might prevent it. This was on the front page of the New York Times. Front page, not even in an insert. How a college-age kid who was doing really well in school went to the psychiatrist at school and said, I'm not paying attention well, and started getting amphetamine. And he became addicted to Adderall. And he was going to multiple doctors. He read the checklist, so he knew what to say. So he was getting amphetamines from all these doctors all over New York, and he was a drug addict. He was addicted to amphetamines. He did not have underlying ADHD, and so the front headline, was how ADHD medicines, are destroying our kids. And they completely missed the boat that, he was abusing the drug. So they're very, very different. But he ended up killing himself due to this substance abuse. So, attention deficit disorder, I'm not sure the name even makes sense. To me, the name that probably makes the most sense is variable attention disorder. Right? Some of these kids can pay attention for 6 hours if they like what they're doing. I have some kids that can actually fish. They can just sit there because they like it. So they can fish or play checkers, but they can't sit and read a book. And that is part of the neurochemistry, variable attention disorder. But if we start looking at different deficits, the nutrients that we started talking about, sleep, and then, probably the one that gets missed is the respect piece. Is early on trying to understand how these kids are not trying to just piss you off as parents or make your life difficult as therapists. They cannot inhibit this behavior, and they cannot sustain this attention. And it's so easy to start yelling at them. And the lines that you hear in my seat, these kids come in, and when the parents leave, what they quote, what we say in anger and hate, because these kids can be so exacerbated. But again, if you take a biological perspective, and particularly focusing on that concept of biochemical individuality, we can begin to. If just a few more slides, then we'll end. So, It's Time was actually a slide I used in 1993 when I started talking about this. Maybe I was a little early, but hopefully we can now begin to help our colleagues and our therapists and our dietitians begin to look at some of these nutritional factors. And ADHD and some of the other illnesses that we're focusing on, seeing it as a reflection of errors in physiology. Okay? And if we find the cause, we might find the cure. If someone's attention problems in college is because they have celiac disease, if we treat the celiac disease, they're going to be able to focus and pay attention. They don't have ADD anymore. I was giving a seminar for a supplement company, not pure encapsulation, a while ago, and they wouldn't let me use the word cure. And I said, but if they have a nutritional deficiency and their symptoms are gone, whether it's hormonal or vitamin or anyways, but they find for mental illness, there's no such thing as a cure. And I assure you, we can eliminate the symptoms if we find the cause. We can't always do it. A couple quick things. This is an incredible conference. I think it's 3 days of just looking at mental health and nutritional deficiencies, sponsored by Great Plains. I'll be speaking there as a couple of other doctors, but it's really a nice place for physicians, chiropractors, nutritionists that are all looking at this. It's September 20th. And here's a repeat of this one, and then I mentioned the depression talk in July. So why don't we stop there and we get some time for questions. Okay.
What is your sense of why exactly ADHD, clearly, like in the last 20 years, it can't really be so much genetic, so epigenetic, but more specifically, what exactly about the epigenetics?
Well, I think it's on the rise for kind of all the reasons we talked about, and not one in particular. So if we start thinking about pesticides and chemicals, if we start thinking of TB, if we start thinking of, actually when we think about zinc, I'm probably most worried about maternal zinc deficiency, so prenatal zinc deficiency, flipping the body into that kind of genetic vulnerability. So I think nutritional deficiencies would take up the biggest chunk, and then if we add in the additives and the pesticides and the TVs and all the other pieces, we kind of get that. As well as the environmental issues about our school and our educational system. An old line I used to use, it was all coming back to me now. We had this ADHD clinic. You heard the hunters and gatherers theory? Oh. So, I mean, there are those of us that were genetically made to sit and plant our little plants and wait for them to grow. Okay, I couldn't do that. So, and then there are those of us that are more interested in going out there and hunting and moving about. So we're kind of genetically wired to do different. So sometimes we're asking these hunters to sit in a classroom for 8 hours and learn calculus. So a lot of it is the expectation. So you see dramatic differences when the environment changes. So you can have these symptoms of ADHD. If you go through any book on ADHD and read about all the famous people, who had ADHD that was famous? Einstein, the guy who, Southwest Airlines, a lot of the famous entrepreneurs. I mean, people that get things done. They just need to have good administrative help and not have to be in school. So changing the environment, and there's some wonderful new schools that are cropping up, and you know, Carl in his testing can speak to a lot of that, and that's part of our struggle when he does testing on someone that is bright. We don't have a response to medicine. We need to find a different educational environment to enhance those skills. So there's probably lots of reasons.
I keep reading that zinc should be taken daily. Would you comment on zinc dosing?
Zinc daily. I think zinc daily is fine. I'm not into high dose zinc. If we're treating an underlying deficiency, 30, 60 milligrams of zinc. I think the danger point is, in my head, has always been 90. All the case studies of zinc problems are over 100 milligrams a day. You don't want to take zinc for long periods of time unless you're also supplementing with copper. But if you're treating a copper excess, 3 to 4 months of just zinc is fine. Again, high dose zinc is a problem, setting up an imbalance of copper. So that's why, other than 10, 15 milligrams, which is the RDA for kids, higher than that, you'd probably want to work with a nutritionist or professional.
Does your testing include aluminum and gliadorphin? And have you seen any of your own therapies help with snoring? Don't know if that's related, but
Well, everything's related because snoring, we know, is a higher association with snoring and ADHD. So I can tell you just anecdotal, taking out the tonsils are probably the most helpful. I've seen some correlation with celiac disease. So absolutely, we have some control. And we know that because if you send 10 ADHD 15-year-olds into the military, I don't know, 7 of them are probably going to do pretty well. 3 of them aren't going to be able to do it because they're that severe. But no, positive reinforcement is just going to be powerful for that first slide, preventing that kind of developmental kind of self-esteem issues. And there is some role for behavioral management. And we see it particularly in young kids. Too much of my practice, though, since 1990, has been with parents who tried, read the book, coming out from 1, 2, 3 Magic to every behavioral control program known to mankind, and the kids are just too biologically out of control to benefit from it. So the work that we would do, whether it's decreasing copper or using a medicine, it would just enable you as either parents or professionals to start utilizing behavioral management techniques. So clearly they are helpful. Sometimes they're just too out of control.
In a situation where a patient might have a really damaged gut lining, can you tell me a little bit, do you use all these supplements? Do you heal the gut first in case they don't absorb the supplements you're giving? If there's a lot of damage, if there's an overgrowth of yeast, can you tell me a little bit more about the sequence?
The kids, that's why that organic acid test has been so incredibly helpful. And it'd be really hard for me to even recommend seeing someone with pretty significant symptoms without looking at that test. Because that would help us understand if there is a GI problem, if their yeast is a problem, if that Clostridia is a problem. We'll know that. Now, it's not for all these kids, so that's why I don't spend a lot of time with lots of GI protocols unless I know what I'm treating. But if those are problems, then medicines don't work as well, and supplements don't work as well. So looking at the gut, looking at the overgrowth of yeast or Clostridia due to overuse of antibiotics. Sometimes these kids have been on 20 antibiotics. Sometimes they just had 1 course, for sinus infection, 3 weeks, and it's disturbed them.
What do you do to heal that then? What do you have a protocol that you use to?
It's hard to do protocols in this business, but we start off with high-dose probiotics, and then if we need to, we use antibiotics or antifungals, depending on what's going on. But step 1 for the kids, 70% of the time, is adjusting the probiotics has been pretty simple. But again, not the health food store, hundreds of billions of CFUs to get the response we need in the gut.
I just wanted to add on to her question because
Sure.
a lot of the kids that I see are actually addicted to substances. So a lot of my work is getting them off of the substances, but then you start to see more of the ADHD behaviors. So for these children, what would be your recommendation?
Okay, so you're talking about someone who's addicted to Adderall or other drugs.
Well, a lot of times they go looking for other drugs, so they're trying to manage their ADHD behavior, so they're either taking opiates or they're smoking pot every day to help themselves manage so they can maintain attention at school.
Okay, no, great question. And I believe some seminar down the road we'll talk about substance abuse because I believe substance abuse is probably the most powerful reflection of a nutritional deficiency in the brain. I mean, these guys and gals are just desperately looking for some neurochemical piece, right? So whatever it takes. And we often, would use other medicines to help them get off the substance of abuse, but anybody committed to the nutritional approach, it is very effective. Magnesium, the amino acids. So be careful with the amphetamines if they have a substance abuse history. but their neurochemistry is out of control. They're doing anything they can to calm it, and we would look to either targeted amino acids and/or aggressive nutritional therapy. Frequently see pretty dramatic B12 deficiency and a lot of our substance abuse, young adults and kids. So looking at the underlying cause would be the goal.
H. pylori can also be a factor with the absorption issues. I've been finding that a lot with people lately. But also, how accurate are heavy metal panel tests that they do blood tests, just the generic heavy metal panel?
Yeah, I mean, a lot of people have come to me because they've had slight elevations of a heavy metal on a hair test or a blood test, and they've spent millions of dollars with chelation, and seeing me and we find something different, they still have that level and the ADHD is better. So it's kind of confusing. The blood tests are accurate for very high levels. We look at it. I think the hair test is probably a better indication for accumulation of heavy metals. To me, lead, mercury, cadmium are the most common that we're seeing, but it takes a long time to help the body get rid of it. So we need to usually do other interventions. So the heavy metals, if you just look at heavy metals, I think a lot of times you get lost in treating these kids because you're not looking at everything else. If you look at the heavy metals with everything else, usually we can help to more slowly eliminate the problem.
You mentioned nutrient deficiencies based on medication use, and I wondered if you could say a little more about nutrient deficiency as a result of psychotropic medication use.
Okay, well that's our July seminar, but the punchline is amphetamines cause deficiency in magnesium. That's really consistent. The antidepressants, which we're going to try to understand in July, by definition it causes depletion in these neurotransmitters that we're trying to treat, right? It just kind of tricks the brain into keeping these guys around longer. There's a feedback mechanism, so your body says, okay, we don't need as much. And then what happens when you try to stop it? Your brain goes haywire. So that whole kind of amino acid complex that we'll talk more about in July is probably the core with the antidepressants. Magnesium is the core deficiency with the stimulants. The other deficiency is folate and folic acid. So most of the psychotropic drugs, particularly the mood stabilizers and anticonvulsants, all cause deficiencies of folate and folic acid.
I was wondering what hair analysis test you use, and also isn't RBC magnesium a pretty accurate assessment of magnesium level?
I do that on everyone that walks in the office. I just haven't found it as consistently accurate. So the hair test I've been doing since 1990 is trace elements. Great Plains and Governor's Data has one, but for some reason trace elements just been using for many, many years and I really like it. So to look at magnesium, we're putting, oftentimes I do get RBC magnesium being low, and I get the hair being low, and I have 1+1, but other times I'll get it completely normal, and we can treat it, and they're doing better. So again, hard to assess, and that's why clinical is probably one of the easier ways, with really no downside to treating magnesium. So I know, the group from Comprehensive and Pure will be here for a little bit if you have questions, and I'll stay around for questions, but I appreciate you coming out and hearing this information. Thank you.
The very same thing. It doesn't have ADHD in the title there.
This next heading was the exact same thing.
It says cognitive instead of ADHD.
Yeah.